Good afternoon. Welcome to Bariatric Friday. Today is November 4th, 2022. It's another Friday. My name is Kemal Erkan. I'm the chairman of American Surgery Center. And I'm here with Dr. Isaias Irgau. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Thank you. And welcome everybody to another Bariatric Friday.
So this is our journey for 3 of our patients. And I want to bring them up. All right, so Karen, Denise, and Patrick. This is, well, of course, these are, I should probably mention that in every video, they are not real names, but they are real patient data. So in our Bariatric Friday, as everyone knows by now, we are discussing each topic as a unique or just independent topic from rest. So we do have our webinars. Our patients can register through our website, where we actually go through the entire process altogether. But in many ways, it's much easier to process this one by one for different parts of the bariatric process. So today we are going to discuss the care coordination and the impact of care coordination. Why do we need care coordination? What are the different roles of care coordination process and all that? So Dr. Irgau is going to help me with that, right, Dr. Irgau?
Absolutely. I will, of course, Kemal, but as you know, that is an area where you are yourself heavily invested because you do conduct those case coordination conferences on a daily basis. But most importantly, you were critical in really setting them up and providing them structure, not only in terms of getting the right people in the right place, but also having a database that is so effectively useful for us.
So we build that database just going back to year 2012. This was something was done through some Excel file when we were in the partnership with one of the local hospitals. And from that point, I knew that it was not working for us because coordination, although it's done through it's done by our people, coordination requires a strong platform so that we can actually follow through what's started and who's where, what's missing, what's not. Now, our patient population, each of our patients, they have different levels of needs from us. Now, knowing that this is a multidisciplinary program, many bariatric programs are similar to what they need, what they need from in terms of the clearing than others. But we are very unique in terms of the approach to the care coordination because we do have about 5 nurses and 4 administrators, a surgeon, 3 dietitians, facility, the American Surgery Center. They're all part of it. And one of the uniqueness is we do this every day. In the past, this was, and in many places, this is either happening maybe once a month, only for some new patients. And it's not, the patient process not being discussed, maybe, in my opinion, properly, because what I have seen in our patient population, things can change from week to week. So if we are not doing the hand-holding, many patients may be lost in the process. So even for some simple procedure, we know that instructions are so important. So, Dr. if you don't mind, and I won't give names, yesterday I had a procedure that was canceled because I was chewing gum. So I read 2 full-page instructions, and nowhere in that instruction did it say that I shouldn't be chewing gum. Now, prepping for the procedure and going through that entire, like even though it was only 1-day diet, after the 24 hours, you are pretty anxious and you are pretty hungry and cranky. As soon as I was told that the procedure couldn't be done because I was chewing gum, my initial reaction was, it wasn't on the instructions. Because instruction says when I should do X, Y, Z very much in detail, but the chewing gum is not a food. Gum is not food. It's not drink. So then I own a surgery center, so I would know if this was going to affect something, right? So that wasn't the case. It's a simple. Then as soon as what I told Dr. Irgau, and we didn't talk about this, that we were going to actually discuss this in this way, but I thought it was, I always try to kind of understand patient where they are in terms of how they process certain things. And one of the things that we do is this special diet 2 weeks prior to the surgery. And when we don't actually do the care coordination properly, that 2 weeks can be very painful if the patient doesn't get the surgery done. And as soon as I was told no for my procedure, I thought about our patients who are going through this for 2 weeks. And then it made it even more important for me to value the service that we are providing, because this is meaningful for them. So, because even something very small can change everything.
Absolutely. But this is a great example, because really, as somebody who is involved in caring for these patients, now you've had a personal experience that gave you even more what the patient's perspective is on this issue, right? But what I was thinking, Kemal, and you didn't say that, is, it would have been a lot easier for you also to either cancel or postpone, right? Whatever the medication or the treatment was, right? And look at that from a bariatric point of view, right? It takes enormous effort for patients to make a decision to undergo bariatric surgery. And we know that because we know that only 1% of those who actually are eligible for bariatric surgery come forward requesting bariatric surgery. So the 1% that is coming forward are the ones that are making a lot of effort, that are going against the grain, so to speak, of what they hear and what they're told, or how they are perceived because of morbid obesity, and they're taking the step, right? The last thing we want to do is giving them hurdles and obstacles and making it hard for them, right? Well, when we are requiring patients to undergo so many clearances, in other words, so many appointments, so many tests, unless we provide them with intense coordination like we have set it up, it becomes very easy for patients to drop out. In fact, it is not surprising, Kemal, that in most programs, the dropout rate is way, way higher than our program. And that is because patients are discouraged, right? And the discouragement happens because patients may be given a set of instructions and told to get it done and then come back without really somebody checking on with them either by text messages or by phone on a regular basis to make sure that they are succeeding in getting these appointments done. So care coordination may not be the surgery, but it's a critical part of our program. And I'm extremely proud actually to be part of this team, Kemal.
So if we were to, and I always kind of try to see these as if the patient is watching this, so what we want them to know. One is you are going to be assigned to a care coordinator. So you are going to be dealing with one person. Not only they're in charge of your follow-up surgeon appointments throughout the process, but they're also helping you with your specialist appointments. So these specialist appointments, it can be your EGD with the facility, your cardiology clearance, your home sleep study, bariatrician. And based on the blood work that you do, the patients do, we may need to repeat some of those studies based on the values that we have. And having that one point of contact is extremely important from that point. So then you know that it's always going to be one person that you have to deal with. Now, the beauty is we actually talk every day for 1 hour, and your case is being discussed in that. So I run one of there are 2 case conferences, Melza Dimat, our program, our practice administrator, and myself, we have 2 teams, and we rotate those teams every 2 weeks. So then we have some familiarity with the patient, so then when we follow up, we are not missing anything from 1 week to the next. And then we actually, our nurses, they report back to us, and then what's needed, what's not. Facility is there, Dr. Irgau is there. Our nutritionists, they join us once a week, and then they report back to us. So once we know that the patient may need more studies, in some cases, cardiac clearance requires a certain test and maybe another follow-up. So all those appointments are done in the same system. So that actually is a huge benefit if we are able to keep the patient in one network, so then we know when your appointment is. Once they are done, we don't need to actually call anyone to get the results or get the notes. This makes it very effective and efficient. And I know that our drop rate, actually, the other day we were just looking at it. So this is why our drop ratio is very low compared to the other programs or the industry standards. So what else we want to?
So essentially, yeah, absolutely. So the important point also, Kemal, is that patients have real lives, right? They have jobs. They have commitments to their family. They have children. Their time is also very limited, right? And they may not very often be able to do things that we ask them in a timely fashion, even with the support of the care coordinators, right? If we are not able to find that out in a timely fashion, reach out to them and say, hey, you were not able to do your blood work, right? You need to do it at this time, or you were not able to come to your appointment with the heart doctor. We need to reschedule that. If we don't follow up in that manner, then it is very easy for the patients to throw up as well, right? So I know from our system, for instance, you have the ability to communicate in real time with patients, either by a phone call from the case conference itself, or by sending an email, specific email, talking about what the issue is. For instance, if it's the lab work which is missing, the email will target that. If it is the sleep study, the same thing. So by doing this, we're actually supporting the patients in doing this fairly intricate process, understanding that they have a real life as well. And I think this is enormously important for our patients. So the requirements are there, right? Everybody has to go through a number of appointments to be able to prepare for bariatric surgery properly. Of course, there is what we call the medical checkups and medical clearances, and that includes, being seen by a heart doctor, for instance. But it's not just an appointment with the heart doctor. As you know, they may require something called an EKG. They may require something called an echocardiogram. They may require something called a stress test, right? And all that will require coordination. We may need to send them for a sleep study, for instance, if there is a suspicion from the surgeon that the patient may be suffering from sleep apnea. The sleep study by itself requires coordination. Getting the sleep study result, and if the sleep study result is positive, patient may require a CPAP machine. And that CPAP machine needs to be ordered specifically by a pulmonary doctor very often, but the CPAP machine itself may have to come from a different company. That requires coordination. So the peer coordinators are just so critical in facilitating all that. And in our actually practice, we have been in a way lulled into be comfortable with this, and our surgeons actually have taken this for granted. But in many, many other programs, actually, there is a lot more struggle that goes on because patients are not really able to do that. And there may be other things. You mentioned the endoscopy, for instance. EGD is endoscopy whereby, the patient is asleep with a very light anesthesia, and then we put a camera down the food pipe into the stomach and early intestine to figure out to make sure there are no problems that need to be addressed before the surgery. It's an important component of our preparation, and that requires coordination as well. And then there may be other things like going to see a hematology, a blood doctor, for instance, if the patients have problems with their blood count, or if they have a history of blood clots. So all that preparation obviously is necessary, but it requires coordination, and that's where we excel with our care coordinators and the case conferences.
So now, for example, in the case of Patrick, so we had to reschedule the EGD twice.
Mm-hmm.
Well, he has to reschedule the EGD twice, and it's one of the main elements of the clearance.
Yes.
Without the EGD, we don't move forward. And his work schedule, when you were saying that these are real people,
yeah.
Well, they have real life, right?
Real life.
Then, if someone is not able to do it, so the care coordinator's job is to figure out when and how we can actually make some adjustments so that this person can get the EGD done. So just because they have to rescheduling doesn't mean that we are going to give up on them. Absolutely. Now, he also had a follow-up with the endocrinology because his TSH originally was 7.
Okay.
So, and then getting that endo appointment is challenging because if you call any practice today, that's going to be 3-4 months. So based on the surgery process, we would be actually expediting those appointments because we work in this multidisciplinary system. So same thing with, I think, Karen, her A1C, if I'm not mistaken.
Yeah, she's diabetic. I do remember that when we first introduced.
And I think that Denise also is. So then they need these endo appointments. Denise actually, let me just go to Denise for a second. So she did have, so her hemoglobin was under 10. So then this requires another attention. So I think what we want our patients to know is we build this machine in a way that this platform that actually takes care of all the needs before you get to the surgery so that there is no missing link between you and your surgeon and your surgery at the end of the day. So because this hemoglobin can be, especially for females, it can be like not so important based on certain biological differences. But if it's under 10, we still need to find out why. Well, you don't have to worry about it. So as a patient, or you don't have to wait until your next surgeon visit. So this is what the care coordinators are doing. Absolutely. So then the endo appointment, you don't need to discuss this with the surgeon while you are waiting for the appointment because we'll be able to get in your appointment to get you ready and then repeat the test. So then when you go back to the surgeon for follow-up, you have meaningful visits because your surgeon has everything that he or she needs to have to make the moving forward decisions. So the sleep study, the home sleep study is a very simple test. And I think not just for the patients with morbid obesity, but everyone should actually take the home sleep study at least once because sleep apnea is, if it's not treated for long term, it can create cardiovascular issues. It actually goes to a different level. So it doesn't stay on its own and then you just have the sleep apnea. That's not the case. It actually evolves and it becomes something else or something more severe. So that's why everyone should be actually getting it, but especially our patients. But it's done in a different place, but we already have everything ready for you to get this on time, and then the follow-up from the DMU company is also coordinated with our care coordinators and with the practice. So this makes it a lot easier. So then, because I can only imagine, and especially like going through a very small procedure and then trying to read the instructions like a couple times, I probably have more appreciation for that perspective that needs to be done, right? So then you understand that you can't miss anything, or if you miss something, or if you have questions, what is next? Those are all important things, and then care coordinators will make this easier. So what I was trying to say is that it makes it sometimes it makes it a little bit cumbersome when you tell the patient that they need to go through all these things. Well, they are not that cumbersome when you have a full-time care coordinator with you.
Absolutely.
And one of the things that also we do in terms of total number of bariatric surgeries, we actually do less than what we used to do 4 years ago, just because we want to spend more time with our patients, more quality time with our patients. So we don't want to have like 100 patients and then 70 of them dropped in 3 months. We want to start with 65 patients and then 50 of them are going through the program. So this is what we have built for our patients, so then they can actually safely get to the time of the surgery. And also these care coordinators do schedule their after surgery follow-up appointments up to 5 years. So
absolutely.
And
so and the other point that is very important, that is much more clear to the surgeons, is what happens on the back end, right? What happens in the back end is that those care coordinators are also a bridge between the test results and the surgeon himself, right? So they are able to look at these test results and send them to the surgeons, so the surgeons can look at them and act on them in a timely fashion, whether it is a test result that requires referral to another specialist, whether it's a test result that requires further testing, or whether it is a test result that requires discussion with the patient, right? So that timely information to the surgeons also is enormously important, because obviously minimizes the wasting of time, but also it's very good for the patient also, because if there is something abnormal, the patients will want to know about it soon, and they will want to know that it's being taken care of in a timely manner as well. So the back end work of the case coordinators, following up on a daily basis, what's happening with their patients, and then communicating that to the surgeons also is enormously helpful to us. One issue that I would like to bring about, Kemal, and that's very important, is that we've started talking about, Karen, Denise, and Patrick almost, 2 months ago or 3 months ago, right?
About 2 months.
2 months, right? And they still haven't had their surgery, right? And the reason is also because of this preparation period. And patients may wonder, why is this all necessary sometimes? Well, it is necessary because bariatric surgery is a life-changing surgery. It's not like other surgeries where you have, an ailment, a hernia, that the surgeon takes care of, and then you go back to your primary care doctor follow-up. With bariatric surgery, we're actually changing the way a person lives in terms of how they eat, how they perceive food, how active they are going to be, what kind of health problems they're going to be confronted with. And all that requires a preparation, not only physically, but also mentally and emotionally as well. And that requires interaction with a number of disciplines and specialists, and navigating that intricate process is really helped and set up by our case coordinators. So we excel at that, just as we excel with the surgery, because we're so much experienced with the surgery as well. So a solid program with a solid case coordinating setup and experienced surgery is really what gives our program uniqueness and excellency.
And the other thing that I wanted to say, what we build, so every day we try to make things better and try to improve the process that we have in place. And because we are hands-on with the process, we want to make sure that we have the most effective way to communicate with our patients. So we build several different template letters coming directly from our system. And I do want to make sure that patients also understand why they are getting them. Those are either during the case conference or in between. We may be sending you those just so that in case of Medicaid patients, you need 6 consecutive nutrition visits. Well, that's a lot of stress on the patient, but also it's a lot of stress on us, because if you know that they miss one, we are going to be we need to make sure that they are not, like, just imagine this way. So you have 6 consecutive months, so then you did two months, and the third one you missed. If the care coordinators are not hands-on, and if you don't have the case conferences, chances of you restarting the process is high. So this means you have to now push the surgery date by another 2 months. It's already 6 months already is too long for this is only for Medicaid. It's already too long, because if you have a commercial insurance, this can be done in 2 to 3 months. And but once it's 6 months, now we have to make sure that those patients, and imagine, like, this program is designed in a way that our Medicaid patients are getting the Ritz-Carlton treatment just like any of the other patients. In fact, we may be spending more time with them because of the requirements that Medicaid has, but the service is at the same level. So this is where the care coordinators make a huge impact. So what we expect our patients to do is to make sure that they understand the role of the care coordinators, so that they need to work with them and communicate with them and make sure that they understand that they're part of the team, and that they're trying to help. And then with these letters that I mentioned, it makes it more efficient to give you the message, so that we don't have to call you for some simple message. And they're able to text you, and you're able to text them back. This is a huge benefit as well, because these days, the wait time on any of the medical offices is long, but you don't need to. So you can actually text the person. These are all great benefits for the care coordination, and we want to make this experience more pleasant. So the bariatric journey turns into a very pleasant experience for these 3 individuals and the many others who are part of the program. So I think one of them is going to get the surgery, Dr. Erkan, I believe, in the next couple of weeks.
Okay, wonderful.
So I don't remember which one, but so we'll have our weekly Bariatric Friday. So we'll actually probably just give the process based on when they get the surgery. And it's not easy, but we make it a lot easier. So, and then we want our patients to take, not just our patient, but any patients who are considering bariatric surgery, as this is the #1 most effective way to treat the morbid obesity. We want you to take advantage of the process. So this is safe, but we made it safer. This is efficient, but we made it more effective. So hopefully we can reach out to more people and help more patients.
Absolutely.
Dr. Erkan, thank you for joining me today. And
thank you, Kemal.
next week.